So I'll just start again. Hi, everybody. My name's Kerry-Ann Dooley. I'm a member of NPAQ and currently based in Brisbane, well, Redcliffe to be more precise. And we've started this palliative community of practice to just engage with NPAA, so the Nurses Professional Association of Australia members right around the country who are interested in palliative care, would like to learn more, and network with each other. So this is our fourth session, and we started around the palliative landscape and palliative symptom assessment. Then we had Dr. Philip Good, who presented on pain and symptom management. And then last month in July, we actually had a nurse practitioner, Andrea Coe from Hummingbird House, present on paediatric palliative care. And quite a few of you have sent in suggestions about education and things that you're interested in the palliative care space. And quite a few indicated that you're interested in death doulas and what the whole concept is around being a death doula. So I have asked Jacqui Williams to present today. Jacqui is a colleague, but she's also a dear friend. And Jacqui, I was thinking today that I've known you since about 2009. I believe we first met when we were running a palliative care support group out in the Wynnum Manly area. And we both worked for a large Queensland not-for-profit community aged care service and ran a palliative care support group. And I've stayed in touch with Jacqui. We've worked together and then have certainly gone our different ways. But Jacqui's always had a special interest in palliative care and has expertise in that space. And it's a great pleasure to be able to have you present tonight, Jacqui, and thank you for your time. So in the interest of time, we'll hand over to Jacqui, but if you'd like to put in the chat bar where you're from, say, hi, it's Jane and I'm from Melbourne and I work in paediatric palliative care or I work in residential aged care, just so we've got an idea of those who are attending tonight. So usually, Jacqui, we let you present and then hold over questions to the end. But if people have questions, they might put it in the chat bar, if that's all right. And then I'll interject if necessary.
Sure.
So hand it over to you for about 45 minutes and then we'll have 15 minutes for questions and wrap up by 7 o'clock. How does that sound?
That's great. Thank you. Can you hear me? You can hear me okay?
Perfect.
Yeah, good.
Fantastic.
Okay.
Great.
Well, thank you to Kerry-Ann and to the NPAA for the invite. It's a real joy to be part of this tonight. And thanks for your interest expressed about being a death doula. So I guess I'll cover a whole range of things tonight, but you may be intrigued. How does a registered nurse who's still a registered nurse, but also become an end-of-life doula? And I just need to clarify that when I work as an end-of-life doula, I'm an end-of-life doula. I'm not a registered nurse. I don't pretend that to bring those skills and attributes to any of the clients or services that I deliver. I work within scope of what a doula provides. So tonight, that's what I'm talking about. But obviously the experiences I've had and learnt, not only professionally, but also personally in the area of palliative care, end-of-life care, bereavement, grief and loss, you can't help but bring that into your practice. And you'll find a lot of end-of-life doulas actually come with a nursing background, an allied health background, some are counsellors, and some are just, not just, but they're people that have had life experiences and aren't a health professional, but they bring that life experience about end-of-life and palliative care to their position. What got me started as an end-of-life doula is in 2016, 2017, I had 6 significant deaths of friends and family. The most significant person was my mum. Unexpected death, catastrophic stroke, died 6 days later. But I also had some friends that died expectedly and some unexpectedly during that time frame. And I was on the cusp of thinking about whether I'd stay in a corporate nursing role or whether I would, what I would do. And my passion, as Kerry Ann said, has always been in the area of end-of-life care and, well, palliative care, not just end-of-life care. And so I decided to take a bit of a gamble and a bit of a jump and start my own business as a sole trader, end-of-life transitions back in 2018. So within that role, you'll find that there is no prescriptive role for doulas in Australia. What we do is some of what I'm saying to you tonight will be across the board with what end-of-life doulas do. And some of it we bring our own niche and our own flavour, I guess, to the role. And I'll talk about mine later on. But one of those flavours, I guess, is I have chosen to be a funeral celebrant. Not all doulas do after death care of the deceased person after they die. Not all of them do funerals. But that's the beauty of this role, is that we bring our own expertise into these roles. I'm also a workshop facilitator, so I'm the first Australian that's done, who is a licensed Willow end-of-life facilitator. So you'll find a lot of us doulas actually have multiple hats that we wear. And one of mine is I do Zoom and face-to-face workshops on pragmatic, heart-centered workshops that motivate people to think about their own mortality, the reality of their own mortality, and also to look at other areas of.
May attend one workshop number.
Sorry, we might have to get people to mute themselves. Sorry.
Can you make sure that you're all on mute? We can hear a bit of background noise. So I don't want to mute everybody because then I cut Jacqui off. But if you can just check your status and just mute yourself while Jacqui's presenting.
Thanks,
Sorry,
Kerry.
Jacqui.
No, that's okay. We're also involved with compassionate communities, and I'll talk to you about that in a minute. And I'm one of the most active Death Cafe facilitators in Australia, running them 2 a month. But I guess the concept is to normalise death and to normalise grief and loss. And we know that in our Western society that we've institutionalised and medicalised death and dying. So when you think about 100, 120 odd years ago, we were born at home and we died at home. And if we didn't die at home, the dead were often brought home where they could be brought home. And it was the family, particularly the women of the community, that would care for the deceased person, and they would have rituals. But children, all the way up to the elderly, witnessed death, birth and death as normal part of living and life. And we've walked away from that in the Western society, mainstream Western society. So as you'll see with this title, I've written that an end-of-life doula, and I call myself an end-of-life doula, as do most Australian doulas, is a life and an end-of-life companion. And there's a bit of a term that's going around now at the moment that we're called a compassionate companion. So the terms used for end-of-life doula are varied, but like I said, most of us in Australia call ourselves end-of-life doulas. But you will hear some call themselves death doulas. And what I'm finding, which is intriguing, is it's mainly academics that tend to be calling us death doulas. There's a few articles that are being written out there, Flinders University, etc., and they're doing research on the doula role, and they tend to call us death doulas. Some of my colleagues call themselves death midwives, some end-of-life consultants, and you will find some call themselves death walkers. So I don't know if any of you have heard of Zenith Virago. Zenith lives in the Byron area, and Zenith was the first person that I linked in with to do my end-of-life doula or death walker training with. So basically, you'll see those terms bandied around here in Australia, and it's internationally, you'll see those terms as well. So what do we do? And you'll see acronyms. Nurses love acronyms. Health professionals love acronyms, don't they? Well, we do too. So it's EOLD is often what you'll see us write up as. So I guess the origin of doula or doula means female slave, which doesn't sound very good, does it? But if you go further, it actually means women who serves. Now that doesn't mean that an end-of-life doula can't be a male. Of course it can be, but we'll find predominantly most of us are female across the world. And you may have heard of a birthing doula. So they are quite well evolved in both Australian services as well as internationally. And often in the past, they were the traditional village midwife who was sometimes the traditional healer. So now we have, and as I said, we have always had the a doula that's been end of life years ago, but then we've sort of mainstream and medicalized things. So it's been diluted. But it's really important to know that an end of life doula is non-medical, it's non-allied health, it's non-nursing. There is no way that an end of life doula is there to replace the role of the nurse or the doctor or the allied health professional or the personal care worker for that matter. You do the clinical and the care support of people who are palliative and at the end of life. What an end of life doula does is the non-medical aspects that often you don't have time to do. That could be due to funding constraints. It could be staff, patient, resident, client ratios, a myriad of reasons. And it doesn't mean that some of what a doula does that you don't do, but a doula has the luxury of time. So please don't think that we are here to replace, we are here to complement. So some of the elements that we do, these are what we hone in on: the emotional, the social, the spiritual, existential, and practical support of persons that are well, that are facing the end of life, their support persons, and the bereaved. Where can we do it? We can do it in a person's own home. We can support a person in residential aged care, in hospital, and in hospices. There's a lot of the sandwich generation out there where they're people that are in their middle age or young 30s, 40s, and they're juggling, or 50s, and they're juggling their own families, their own career. They might be geographically spaced from where their aging parents are, but they're also often juggling their aging parents. And it's sometimes very hard to be with a person when they're in hospital or a nursing home or residential aged care, or even in their own home. And that's where the doula can support people. And we can also be there in hospices. There are some hospices that are starting to engage doulas as paid positions. And we can be employed, privately paid, or as part of, and not everyone does this, but I do this. I have a number of service agreements with providers where people who have a home care package can actually engage my services as a doula to support them in the emotional, social, spiritual, practical sense, whether they're at the end of life or whether they have a life-limiting condition. And self-managed NDIS national disability participants can also engage my services, for example, as an end-of-life doula. Or people can, like I said, privately engage. And we're not restricted by time. We can do visits across the board 24/7 for most of us. Some doulas aren't as flexible as that, but I know that I offer those type of services, as do some of my colleagues. And it's not about us. We link with other health professionals that are involved, obviously, other contacts that that person has, and other doulas, because it's not a one-man show, it's a team. So I mentioned that about doulas being about life and not just end of life. And what my mantra is to engage with people when they're well, rather than wait for someone to reach a crisis point where they're either facing a life-limiting illness, and particularly a terminal illness, or they're in casualty and they've been told that their loved one's dying. So, or in a residential aged care, and the same thing, but have never had a conversation. So the idea is to engage people well, to start getting them to think about the reality of their mortality and do some planning. And I'll show you some examples later. It is obviously supporting people with a life-limiting illness. And a lot of that is people with chronic conditions and comorbidities. Really important part of what we do, and big part of what I do, is because I've worked in community, and Kerry Ann would know this, I've been in community since the late 1980s. And so I know my aged care and a lot of services in my area of Queensland really, really well. I can help people service navigate and connect the dots. We support people actively dying, so in that terminal phase of dying, and sometimes that is very short time notice. They might only have a couple of days to live. The other day, a young daughter contacted me, and mum got a very advanced terminal diagnosis, and she wanted my support to guide a mother through this and guide her through this, importantly. Before she contacted me, they actually operated on a mother who had advanced stage 4 disease, and her mother got complications and got peritonitis. And so I knew that she wouldn't have very long to live. And she died very shortly afterwards. So there was support. The main support there was for the daughter. And supporting persons for the whole journey. And what I mean is people can engage a doula as early in the diagnosis as they want to. So it could be that they have just been diagnosed with Parkinson's or something that has considerable time frame to it, potentially. And then also engage us afterwards with bereavement and support after death care, which may include funerals and ceremonies, and also practical bereavement support. Now, when I say practical, I'm not saying we in no way are saying that we're counsellors, although some of my doula friends are counsellors. But what I mean is sometimes people are in that brain fog when someone dies, and they just need to get some guidance about who to inform, how to inform, doing a checklist. It's a bereavement checklist that we've got here in Queensland that is really helpful to go through with families, and just supporting them along the way. So the evolution really quickly of end-of-life doulas and compassionate communities. I guess someone who's inspired me ever since I started my nursing was Dame Cecily Saunders, and she's the modern day hospice, the founder of modern hospice. And the saying that's on the screen there, you matter because you are you and you matter to the end of your life. We will do all we can not only to help you die peacefully, but also to live until you die. That's my mantra. My mantra is an end-of-life doula. And what happened was there was a hospice movement that started in the 1960s, 70s and 80s, and particularly in America. And then a birthing doula, this lady here next to Dame Cecily Saunders, her name's Phyllis Farley. She was a birthing doula, a very well-known one in the America, and she attended an end-of-life movement in America, and then she thought, why can't we look after people as doulas at the beginning of life? How about the end of life? And there was an evolution that happened in America with regards to the end-of-life doula movement. History continues, and then in 2010, John Underwood from UK was a Buddhist, and he was doing a few projects on death and dying. And he decided that he would go and see a man called Bernard Crotaz in Switzerland. And Bernard was a university lecturer, and he and his wife at that stage were teaching on funerals and rituals. And he had set up what they call Café Mortel. And from the concept of Café Mortels came the concept that John Underwood created called a death cafe. I call my death cafes Death Cafe by the Bay, if ever you're interested in zooming in, or if you live in the Brisbane area coming to a Victoria Point one. But the Death Cafe is having open, relaxed conversations about death, dying, grief and loss. If you go to deathcafe.com website, which is overseen by John's mother and his sister as volunteers, you'll find there's guidelines there, and anyone can run a death cafe. But to call yourself a death cafe, you need to follow the guidelines. And what it was over food. It's free. There's no whiteboard. There's no PowerPoint. There's no agenda. It's organic discussion with a group of strangers. And sometimes it's not a group of strangers. I've got some people that have come to my death cafes 10, 11, 12 times, because each death cafe is different, because it's organic and the discussion is organic. I just purely facilitate it. And John died of complications of leukemia 2 days after he was diagnosed in 2017. So death cafes could have died a death. excuse the pun, but could have died of death back in 2017. But his mother Sue and his sister Jules continue the legacy. And there's over 81 countries across the world now running death cafes. And nearly 14,000 death cafes have been run since September 2011. But death cafes are one way that doulas, a lot of us doulas, are actually promoting death literacy to get our communities more skilled, informed and knowledgeable about death and dying. And I know that you would do that in your role as nurses as well. There's alliances that have been developed in America. There's one called NEDA. There's one in Canada. There's UK. And in Australia, I was part of an end-of-life doula group where we tried to start our own here called ANELDA, Australian National End-of-Life Doula Alliance. It hasn't really morphed into anything too major at the moment, but hoping that one day we'll have a membership organisation that people will be interested to learn from. Another person that inspires me is Aussie Professor Alan Kelleher that some of you may have heard of. And Professor Kelleher was instrumental in the 1990s in a public health movement development that he developed with others called Compassionate Cities. And under the arm of Compassionate Cities is Compassionate Communities, or fondly known as ComCom for short. In Australia, you may know of the Groundswell project, and it has been instrumental in providing resources and inspiring people to start their own compassionate communities in their local states and territories. And for some of you around Australia, I know there's compassionate communities in Victoria, New South Wales, West Australia, South Australia. We've got, I'm a project lead here in Queensland for one, and I know there's some up in the Sunshine Coast, etc. So there might be one that I haven't mentioned in your state and territory. But Professor Alan Kelleher wanted to remind us that dying or death is a social event, not a medical event. It's a social event with a medical component. And what he refers to is the 95% rule. And what he says that if you are the person with being given with a palliative diagnosis, from the time you get that palliative diagnosis to the time you die and take your last breath, approximately 5% of that time is spent in front of a health professional. Now, most people in the community would think it was a lot more than that, and maybe you would too. But this is based on research that he's done. And out of that 5%, he said about 3% was in front of a doctor, about 8% was in front of a nurse. And I think it was a slightly less percent with allied health, might have been 7%, but it averaged to 5%. 95% of the journey, the person does that journey by themselves, or they do it with their spouse, their family, their caregivers, their neighbours, their work colleagues, their schoolmates, if they're young people with a life-limiting condition, their churches, their faith, their hospices, etc. So that 95% is the whole of community, plus the health professionals makes up that compassionate community for people. And that's where the doula movement comes in. If you ever get a chance, go to Google Vimeo video, June 2018, Alan Kelleher, and you'll see an awesome video that Alan's done about that. He talks about compassionate communities, but he is passionate about the role of where the death doula, he calls them, the death doula or end-of-life doula fits into our palliative care within our society. So we're there as doulas for the 95%, working alongside yourselves as health professionals. And our target group, is the person living with a life-limiting illness, their informal carers, their family, their friends, their work colleagues, etc., their children, and they're the bereaved, the people who are grieving. So what types of services do we provide? As I said, something that we've got the luxury of that often you don't in your own practices is time. A person can engage with the end-of-life doula for as little or as long, as early or as late in their journey as they want to. And we provide those 4 major things on the screen there. So we can support the person and their family to have the important conversations. We often think of having advanced care planning conversations and end-of-life conversations as being difficult or challenging. And are they? Yes, they can be, very much so. But if we confront or talk to our clients and our patients about the fact that we use the words, these are really difficult or challenging conversations, and if that's the first thing that comes out of our mouth, then we paint a negative conversation or a mindset already. So instead of using the word challenging or difficult, flip it with the word important. Let us have the important conversations. Tell us what you value most. Tell us who and what matters most to you so we can be there and be your voice or know what you want, should you not be able to articulate it yourself or when you die. As nurses do, we listen. I mean, a big part of what a doula does is listening and being there. It's offering emotional support and it's being a person's advocate. A beautiful lady who's end-stage chronic obstructive airways disease has engaged my services to support her in her end-of-life journey. She doesn't know what her prognosis is, but she suspects it's probably less than 3 months. And she's been living with this condition for a long time. When I spoke to her, she said, Jacqui, I want you to be my advocate. I've got all this myriad of services, palliative care, community services, doctors, specialists, all these other services in place. They're all very good, but they don't connect. They're not talking to each other. I need someone to be my advocate, to sit with me when I'm talking with them, to navigate me through this and connect the dots for me. And that's one of the roles that I'm playing as her end-of-life advocate. Being available when others can't be, and we talked about the sandwich generation. I've also got a daughter from New South Wales who's engaged my services for a mum here in Queensland because she can't be there. She flies up every couple of months, subject to COVID availability and stuff, but she just can't be there, and she phones mum every day, but she knows that's not the same. Some doulas, as I said, don't do active dying. They participate in the front end part of doula work, and they don't actively support people when they're actively dying or after they've died. But a lot of us do. And it's being present. You might hear the term holding space is a pretty common one in the doula world. And we offer time to explore. What do we explore? We offer and explore opportunities, bucket lists. Bucket lists are important. We're helping people live life till they take their very last breath. What are their bucket lists? And if they want us to join them and help them achieve that, we can. Or in Queensland, we're lucky that in the area I live near Brisbane, Palliative Care Queensland has ambulance wishes, which I think they're also taking to Townsville now. Ambulance wishes allows people to have a final wish enacted with some nurses, paramedics, and other support staff, taking them to do whatever they want on their last special wish for free. But doulas can do that as well and engage with people where they want us to, or at least explore what their bucket list is, and then they can do it with their loved ones. Storytelling and legacy writing is really important. And as a Willow educator, I have some tools at my hand that I can use with people where they really, really explore what legacy do they think people, if they ask their loved one, what legacy do they think their loved ones would think they're leaving life if they died tomorrow? But what legacy do they want to leave, and how do they achieve that? And I'm a big advocate for living wake. So while I support people in doing funerals, I can also support people in crafting their own living wake, which is a living funeral. So why wait till you're dead for people to tell you the stories and how much they love you? My children and my partner, Neil, know that I want a living wake. And I've already started my Spotify list, and it's called Jacqui's Living Wake, so that all my favorite songs will be played at some ceremony where I can choose who I want to come, the people that mean the most to me, which for some people isn't their family, but it is for me, and their friends, and I can tell them what they've brought into my life and they mine. But people don't know how to do those, so I can help craft that with them. We can explore getting the person to describe what does a good death mean to them or look like to them? Some of these questions on the screen, you know, they're questions that you probably ask your patients or residents or clients now in your nursing. And it's exploring these questions that are important questions that sometimes people just don't go there. I have a number of doula clients where they say, I want to talk to my family about this, but they just won't go there with me. So they want someone to be able to mediate and try to get the family to engage in that space, or at least give them an opportunity to write it down or to have it documented what's important to them. As part of my Willow, and not, like I said, most doulas don't have this opportunity because I'm a licensed Willow educator, but it's talking about the reality of your mortality, and you're looking at what makes sense of life and death, our grieving, our legacy, our love letters that we might want to write people. How do we plan for our departure, our final body disposition? Some of the questions are up there as well. Is we look at emotional and spiritual exploration. No, I don't pretend to be a counsellor. I'm not a counsellor. Okay, but there's no reason I can't explore with people these questions and guide them about what is important to them. And it's quite interesting as nurses or as an end-of-life doula, if we were to individually look at those questions and answer them for yourself, that gives you a better understanding as how you can approach them with your client, patients or residents. So being there for the support persons and after the person dies. It's a lonely place after a person dies. It's a hub of chaoticness when a person immediately dies in a hospital, residential aged care, maybe less so at home. But there's a lot people are having to think about just to plan for a funeral, etc. But it's the time when they're alone that is a huge time that they have, that they are alone. And it's often 2 or 3 months down the track where the loneliness really hits, that someone's not walking through that door anymore. We provide guidance of what to do after a death. I'll talk about that in a minute. We guide someone on services, open the conversations, and can be that conduit between family or support persons. We look at rituals. Rituals are really important. You can do rituals before a person dies. And by rituals, it might be simply engaging in something as simple as a candle being lit, a prayer being said. It could be music being played. My dad died 2 months ago and I was vigiling by his side for a couple of days. And I knew his favourite songs. We'd had the important conversations and gently I would play them now and then to him. And I knew he was unconscious, but I believe there's a subconsciousness. But some of the rituals that I've done with people as an end-of-life doula are ashes scattered at sunrise at the Sunshine Coast. Painting a mother's toenails for a lady who died. She was 96, a little pocket rocket, ended up with cardiac failure, died within 2 weeks, but she'd always been a lady. And her daughter and I cared for her mother, washed her mother after she died. And the daughter just said, Mum always had manicured fingernails and toenails. Can I paint her nails? And I said, yes, you can. And for her, that was a memorable moment that she'll never forget because she felt that she completed her mother's journey with her being the lady that she was. Amethyst and white feathers. I was gifted this feather with amethyst when I was a celebrant officiating. And so as a doula, I'm also a celebrant. And everyone that came to this particular lady's funeral were gifted by the family a white feather that was to do with love and honor and purity, and the amethyst with their peacefulness. And everyone was gifted that to take home as a gift, and that was their ritual. Some of my colleagues do Reiki and medication, goodness gracious, meditation. And I don't do Reiki. I'm not a trained meditation, but I do visualization with people. And some of my colleagues do essential oils before and after someone dies. So we bring our own flavor to the roles. And my passion, I guess, one of my passions is talking to people about their final disposition. And I challenge you, and good on you if you've done it, but have you ever thought about the moment that you stop breathing and what happens to your body between then and the funeral, your body disposition? And I would suggest that most, if not all of us, have not thought about that. And so it's engaging in that space. And I say that because we need to plan for our end of life as a gift to our families and our loved ones, so that they're not caught up in they're already caught up in the emotions of death. But if they know what you wanted, it makes it so much easier. So many funeral directors I work with say that they have a son and a daughter will come, and the son will say, Mum wanted to be cremated, and the daughter will look at the sister will say, no, she didn't. She wanted to be buried, because they haven't had the conversation, or they might have had different conversations with Mum at different times of her life, but neither shall they meet. So it's really important. But that time period after the last breath, I know that I want to have clothes on. I know I want a blanket on. I know I'm dead, but I'm a cold frog in life. So I want to be dressed when I'm dead, immediately after I'm dead. Okay, where I can, if it's not a traumatic death, obviously. And I also want to be with dignity and respect. Okay, and there's a few things else I'm planning with my family. But they're the things that we can talk about. This is a funeral I did a number of years ago, and I did a beautiful funeral today with a lady who came from, for her husband, from an Indonesian country. And underneath her coffin, her family had handmade tice. A tice is a woven fabric, a beautiful, colourful woven fabric that goes under the coffin, so that when the coffin is lowered in the ground, it is the final resting place, and it's a symbol of love, honour and respect, which she has given her husband by putting the tice underneath the coffin and laying him to rest. It meant a huge amount for her that her custom was respected. Just quickly with navigating, and I'm mindful of the time, a big part of what I do as an end-of-life doula, as an advocate, is navigating services. And that's not to replace what you do. But if someone comes to me and they're just not sure, they're not sure of what's available, where to go, I have enough knowledge in the palliative care space to be able to guide them, and they can make their own choices. It's important that you know that. We're not there to say it's Jacqui Way or the highway. It's about their choices, but it's about informing them so that they can build their death literacy and they can make informed choices, because a lot of people don't know what they can do. They don't know what they can do before death or what services are available. At the moment, I'm leading a project of compassionate communities in the Victoria Point and Coochie-Mudlo Island area for a lovely little not-for-profit called Redlands District Council on the Aging. And it's amazing how many people don't know that in the area that we live in, that there's a Metro South palliative care service, and that there's also a private palliative care service and a private palliative care providers in the area. So it's really interesting. People don't know what's there, and they often don't know that a lot of the services are free. But we do know that if someone gets a level 4 home care package and they get community palliative care, for example, that there's a huge amount of time that that person and the family are still navigating the journey by themselves, and that's where the doula comes in. So some of the things, and I'll go through this really quickly because of time, but Gather My Crew is some of the connections that I make for people. So if they want to get a roster system going, they can go to Gather My Crew. That's now got a lovely little nifty app, and they can create a crew, a support network that can support people. I don't know if you know Lisa Herbert's The Bottom Drawer book. She's now made it electronic at all. I've got my bottom drawer book in my filing cabinet all completed. And as my life changes or my ideas change, I date it and I cross out or I add. So my family and my partner Neil know that this is my final drawer book wishes for when I die. Lisa was a journer with the ABC, and she's really quite active now on Facebook and stuff. So check it out. It's a great resource. It makes doing your funeral planning fun. And then you've got conversation starters like Advanced Care Planning Australia, and you've got Your Life Talks, which are great little cards. You've got Dying to Talk. There's a whole heap of ways that I, as a doula, can engage these conversations with a cup of tea and cake. It's really easier, not really easy, but it's easier for people over a relaxed environment of a cuppa and maybe a bicky or some cake to just go through some of those important conversations. And it won't happen in one sitting, but it will start happening. Cancer Council in Queensland, I've got a lovely little CD, Learning to Relax. You don't have to have cancer to listen to a lovely relaxing CD. We've got the Calm apps that have got beautiful meditation, visualization, audios. My death cafes, as you can see on the right there, I call them Death Cafe by the Bay. There's virtual and face-to-face. My Willow workshops. Palliative Care Australia have got a great little Asking Questions Can Help resource. And it's a really good resource for the person who is facing their end of life, but also you can adapt those questions for the carers or the support persons for the person. And it's free. They can get it on the Palliative Care Australia website. Up until recently, I was a registered nurse for a couple of years on top of doing my end-of-life doula work with Pal Assist, which is an information and support telehealth line across Queensland. And so they're there for anyone who's online tonight from Queensland. Great resource. And it's 7 days a week from 7 a.m. to 7 p.m, manned by registered nurses and allied health. Ambulance Wishes, I mentioned before, Palliative Care Queensland has done that. PAL Consults, a Queensland-wide 24/7 support. The doctors, nurses, paramedics, pharmacists, nurse practitioners. Advanced Care Planning Australia's got some great stuff. If you want to know what your advanced care planning documents are in your state and territory, have a look at their site. Queensland, we're very blessed to have My Care, My Choices, where we can electronically upload our advanced health directive, our enduring power of attorney for health, and our statement of choices there. So that doesn't matter if Jacqui lives in Brisbane, but I'm holidaying in Townsville and I have an accident where I can't speak and I need an advanced care directives need to be actioned. Then if I've uploaded it at My Care, My Choices, Queensland Health, then Townsville Hospital can check out my documents. Palliative is a national support, particularly with residential aged care. LDAC, again, great resources through them. So just before we finish, how do you find an end-of-life doula and how do you become an end-of-life doula? So there is an end-of-life doula directory. And in that directory, a lot of the Australian doulas that wish to have got their details on there. So you can search by service, or you can service type like funerals or end-of-life care, or you can search by state territory. Cooling beds, there's information on cooling beds. There's cots for babies that are, it's called Bears of Hope, I think it's called, supply little cots for little babies that die, and if the family want to bring them home and keep the baby cool in them. And there's other resources that you can access on that directory. Preparing the Way is one of the training organisations, and they keep their own end-of-life doula directory for those that have done their training. So, for example, I have not done their training. I choose not to. I've done a lot of palliative care training in my life. So I'm not in their directory. The Natural Death Care Centre, that's Zenith Virago's directory. And because I did her training, I'm on there, and you'll find a whole heap of death walkers on there as well. You can Google search us, Yellow Pages. If we do funerals, you can find us at the Funeral Celebrants Association Australia. And the current training, there's a few in Australia. Dr. Annetta Mallon is one of my colleagues, and she's down in Tassie, but she runs a course that's virtual. Denise Love. Denise is both a birth and death doula, and she's got wide experience in particularly doing end-of-life and birthing doula work over in Thailand and Vietnam and places like that, but she's an Australian. Helen Callanan. Helen's just launched a few months ago a Certificate 4 in end-of-life doula services. That's the first national accredited course. Obviously, because it's accredited, it's not cheap. But that's what some of the new doulas might be engaging with. Dr. Michael Barbado, you might have heard of him. He's a GP that specialises in palliative care in New South Wales. And as far as I know, last year, I think it was, no, this year, I think he ran some TAFE courses called Midwifery Death. And Zenith is now doing her courses by Zoom. So she was traveling around Australia, and some of her courses teach you how to be a funeral celebrant as well. And obviously you've got overseas training. So that's a lot of information that I've just given you, and I haven't had a chance to look at the chat, but I open it up now to any questions. And thank you for letting me at least give you a very quick snapshot in what we do. Thank you.
Oh, Jacqui, that was amazing. Thank you so much. I've certainly learned a lot tonight, and I hope others have as well. And given that we've had a few from the group quite interested in learning more about death doulas and what their scope of practice is, and potentially where you can get more information, I'm sure that you found Jacqui's presentation ticked all the boxes there. So over to anybody who's got specific questions.
Can I just add, sorry, I meant to say, my registered nursing insurance is registered nursing insurance, and doulas, sensible doulas take out insurance that is end-of-life doula insurance. So there are some organisations or insurance companies out there that cover doulas, and so that keeps you within your scope as well. Yeah.
Yep, that's excellent information. So anybody with questions for Jacqui, or she's answered everything that you were thinking? Anyone?
Is it what you thought it was?
No, we've got a couple of chats here. What have we got? Oh, Jacqui's put your email there, which is fabulous.
Yeah, sorry, someone asked me to put the slide up, but I thought it might be easier if I just put it in the chat.
Yes, yep. Lee has said, thank you, that was awesome. Please, can you put your contact details there? And Jacqui is based in Brisbane, and I appreciate that we do have people online that are from all throughout Australia. We've got people from Melbourne, people from Sydney, people from the Gold Coast, Sunshine Coast, far north Queensland. Lee has also asked any information on voluntary assisted dying.
Yeah. So just before I jump into that quickly, just to let you know that a lot of doulas actually do Zoom with clients. So that, and I think COVID has probably assisted us all become very, very good at Zooming. But just so that you know, like I've got a client down the Gold Coast, and sometimes it's not easy for us to align me traveling there. So a lot of doulas do international and national connection with clients that don't necessarily live in their backyard, so to speak. Any information on voluntary assisted dying, is that from a doula perspective, Lee? Yeah.
Yes.
Okay. Yeah. Interesting. Well, not really. If I think about basically what I refer to people, if they ask me about voluntary assisted dying, is I very clearly tell them that it's not legal here in Queensland yet until the 1st of January next year. I think it is, isn't it, Kerry-Ann? I think it's 1st of January next year.
I think it's a bit later than the 1st of January, but yeah, it's coming into effect as of 2023. Yep.
Yeah. And so I tell them that, and then it's basically exploring with them, obviously, why they're asking and referring them on. But there is a really good website, and you may know of it, and it's I'll put it in the chat, but it's called, it's based at QUT, but it's QUT End of Life Law. But if you Google that, it's national. So it doesn't matter what state and territory you live in. There are very, very skilled professors there at QUT End of Life Law that actually do training modules for health professionals, but also provide state and territory updates because it's a changing, moving feast all the time. So as for, I actually had someone the other day ask me about that, because I think maybe what you're getting at, Lee, might be the fact that some people think because end-of-life doulas are a little bit different, they're not mainstream health professionals, that we might actually help them in their lives. No, we're within the same scope, and obviously in Queensland legislation we will be following, and the registered nurse's role and nurse practitioner and doctor's role in VAD in Queensland, it's very prescriptive, and they've already started putting out part 1 of that. So I see the role of the end-of-life doula as being someone that can point them to have the conversations with their doctors, with their palliative care teams, but definitely not in any other capacity. But if they were assessed next year for VAD and were eligible, and they wanted me to sit with them as part of their community when their VAD experience was happening, then I would be part of that if I was allowed to.
Yeah, I think there are quite a few VAD webinars, and I think in October, November, I just can't recall the exact date, but I'm happy to send it through. You can register for a full day seminar that's free to attend on what the process will be. So Palliative Care Queensland, if any of you are members of Palliative Care Queensland, they sent it out in their last email update where you could register. You could register to attend in person at the convention centre or online option, and that will be for anybody interested in how the rollout is going to occur.
I see that someone's asked, do you need to be registered with APRA? No, look, it's not doula is not recognised as a health professional role. If anything, you'd call it an unregulated worker role. So no, it's not a health professional role. There is an unregulated worker, what is it? I don't know what you call it, but a guideline that came out a number of years ago for personal care workers, when personal care workers really started hitting our workforce and being more of a, and it was a national document. And as part of ANELDA, when we were looking at forming an Australian end-of-life doula alliance, I was the one that flagged that that's where I see the role of the doula aligning with, because we're not health professionals. Even if we might have a health professional background in another capacity. And it's a very good question, which relates to, you have to be very clear when you're in these roles to take your nursing hat off and not even influence the client or the family to think that you're a registered nurse in that capacity. You can't slip out of the scope of an end-of-life doula. Otherwise it's fraught with risk. So it is very clear that if people want to know my services, I have doula services, and that's it. That's what they get. Doula fees, doula services. And that's what they know that my capacity is. And someone asked about Aboriginal and Torres Strait Islander people. With involvement, look, there is a beautiful doula down in Canberra in New South Wales. And I'm just trying to think of her name. It's a very unusual name. She does a lot of work down there with Indigenous persons. I personally haven't had any direct involvement with anyone who's Aboriginal and Torres Strait Islander, except I did actually have a lady today from WA phone me after I did my funeral and posted some de-identified info on my social media. She said she's an Aboriginal funeral celebrant from Western Australia and would like to have a chat about services. So, but in my doula role, I haven't had any today. So, would you say there is becoming more work for doulas? Absolutely. This is a movement that's here to stay. And it's because it's an organic movement, and it's a movement that was here 100, 110 plus years ago. And it's something that we've just lost sight of. and it's a beautiful complementary role to the work that nurses and others do in the area. And I know, I can say hand on heart, having been an RN since the 1980s, that you all have great intent and do wonderful work, but you're restricted often by time. Funding plays a big factor about how long you can spend with someone, and also your ratios of staffing. And they're things that are very, very difficult. So unless you work in a palliative care or hospice specific area, you may be challenged by that. And so the end of life doula role definitely is there to complement and support and be part of a team. And I see into the future, there'll be more and more of us out there just complementing and being part of this. And I'm getting a lot of people phone me privately, and they want to engage private doulas because they see that there's value. It's slow, but it's definitely, there's momentum. Yeah. Is it appropriate to ask what I charge? You happy for me to keep going? Yep,
go for it. Yeah, please.
Well, we all charge different things. Okay, so and I can tell you there's no science in it. If you go on my website, you'll see a pricing tab. It's not very easy to follow, but I'm happy. You can contact me anytime. But Monday to Friday, normal business hours, it's $75 an hour. Then it goes up on a sliding scale. So if it's after hours, $85 an hour. Then if it's on weekends, $95 an hour, including public holidays. I do charge travel beyond 50-kilometre round trip. That's from my home to their home and back again. And then for my funerals, I charge anywhere from $500 upwards. And that's what I charge. But you will ask any end-of-life doula, and I'm sure you'll find a very eclectic amount of dollars, just like there is in the health services. Different organisations charge different things at the moment. And what was I going to say? Yeah, and how I got there is because I'm not pretending to be an RN in this role. I looked at private nursing, okay, in one of the organisations I used to work with, and it was up here. I looked at personal care workers, which were here, and I've decided that I should be up here, but I'm not working as a nurse, so I'm going in between, and that's how I picked it. That's a really hard and fast scientific way of doing it, isn't it? But that's how I came to it. So, yeah. What else is there? Thanks for all your lovely feedback too, everyone. That's really nice.
Oh, I think, yeah, you've been really raw and honest and given people a very clear picture of what you currently do, and certainly the history of and why you do what you do. And, you know, if people are interested, would you make your PowerPoint presentation available for people, or send through potentially those?
I can send an abridged version,
yeah, like a PDF or something, just so that people, if they're interested in pursuing some of those.
Yeah, definitely. And like, if anyone's got any questions, I'm very open to that. It's all about building a compassionate community, which means working together and supporting people, some of our most vulnerable people in the community. So that link I just sent now, the Eventbrite one, if anyone's interested in, you know, come to a death cafe. They're not scary. And they become an international event when they're Zoom. I mean, I get people from Portugal and Canada and America and all over the place, and obviously Australia. And if you're in Brizzy, come to Vicky Point. But they're not scary. They're I just can't give you cake because it's Zoom. You've got a BYO cake and coffee. But if you want to do
cake and tea,
if you want to see the other workshops, you know, just, you know, I think until we individually learn get comfortable with our own mortality, and planning and making and giving a gift to our loved ones by doing it, I think how can we have those conversations as easily with other people? And maybe you think you can, but I know I've learned a lot by looking at myself and what I want. So yeah. Do you know an end-of-life doula in Victoria who would allow me to see how they work before I decide on a course? Have a look in the end-of-life doula directory that I'll send in the PowerPoint and search for one down there. Yes, definitely. There's some really good There's a lot of good people out there in this area. Really interesting. They're all a bit different. We're all a bit different. Yeah.
Well, thank
keep
you.
up the great work.
Yeah, thank you so much. That's been absolutely fantastic. I hope you'd all agree. Give Jacqui a virtual round of applause for those that we can see your faces. And thank you to those that have put their comments in there. Really appreciate knowing where you're all from. It's great to see such diversity from around Australia, people from community, residential aged care, med-surg, paediatrics, those that aren't working because of the mandates. Thank you that you've given hope that there might be another avenue for people to explore. And yeah, look forward to sending out the recording and then also some of Jacqui's resources. But please look up End of Life Transitions is Jacqui's website if you haven't been able to grab her contact details. And I'm sure Jacqui's happy to chat offline individually with anybody tomorrow. It's a little bit late tonight, but yeah, thank you everybody for attending and look forward to seeing you all in September. Before we close, I did just want to put a call out to anybody in Queensland in particular. Many of you know that I run a private nursing service and do home hospice, and I'm particularly looking to network with nurses all around Queensland. So if you are a registered nurse interested in doing palliative care at home, you might currently work part-time and have some capacity, because often we get requests for palliative clients at Noosa or Mount Isa, and I don't have staff available in those spaces. I'm just going to put my email in the chat box. I'm just really keen to develop a network of nurses who might be willing to be on call. And if we've got somebody imminently dying, actively dying, and needs that 24/7 nursing, we can work together with local services and maybe some of the NPAQ members interested in that. So yeah, let me know. We currently do it here in Southeast Queensland, in Brisbane, Sunshine Coast, and yeah, potentially the Gold Coast very soon, but looking for far north Queensland and regional Queensland. So feel free to take my email and phone number and contact me if you might be interested in being involved in a home hospice network around Queensland. Beautiful. All right, it's 7:03. I don't want to waste your night, but once again, Jacqui, thank you so very much.
Thank you.
And look forward to seeing the rest of you in September for our next one. I don't have a speaker yet, but we did reach out to one of our members who works for the Space Project in Metro South, and I think she was keen to present soon. So that might be our September presentation. All right. All the best and take care, everybody. Stay safe and well. Bye for now.